Hi, my name is Michelle Embleton, and in this video, we're going to look at what is ovarian hyperstimulation syndrome and how is it treated. Ovarian hyperstimulation syndrome, or OHSS, is something that can occur during an assisted reproduction treatment following ovarian stimulation. Specifically, OHSS is related to the hormone chorionic gonadotropin, or HCG. This is used after ovarian stimulation to induce ovulation. Normally, OHSS is mild and doesn't pose any major health problems, but it can lead to more serious problems if it develops into a more severe form of the syndrome. In this video, we are going to look at when does ovarian hyperstimulation syndrome occur, how can OHSS be prevented, what are the different levels of the syndrome, and how can we treat it. Then we will finish by looking at a couple of the most frequently asked questions from our users and answer them for you. Ovarian hyperstimulation syndrome can occur following the ovarian stimulation of an assisted reproduction treatment. The HCG hormone is given usually to trigger the final maturation of the egg cells prior to the egg retrieval. HCG is actually the main trigger cause of OHSS, as it increases the vascular permeability of the cells. This basically means that the spaces between cells in the ovary can become filled with fluid. Early onset OHSS can occur up to a week after the administering of the HCG to mature the follicles. There is also a late onset OHSS, and this is due to, if pregnancy is achieved, the hormone HCG will actually be produced by the body as part of the pregnancy, leading to increased levels of this hormone. The first step we need to take in order to prevent OHSS is to look at the patients who have a higher risk of developing this syndrome. To do this, we need to look at the risk factors, which involved a patient of a young age under 30 years old, if a patient has polycystic ovary syndrome, in cases where the patient has a low BMI, in cases where there is a high antral follicle count, or there have been previous instances of OHSS. If on the day that the HCG is administered, the patient gives a measurement of increased levels of estradiol, it is also a risk factor. In general, the ovarian stimulation procedure should be monitored carefully and closely in all patients to avoid any potential complications such as OHSS. In this way, if the patient is giving an excessive ovarian response, the specialist can act quickly to prevent this from happening. One way of doing this is to alter slightly the protocol of ovarian stimulation by administering different kinds of medication. Ovarian stimulation can be performed with GnRH antagonists and then stimulated with GnRH agonists, which avoids having to use HCG to induce the maturation of the follicles. For patients who have polycystic ovary syndrome, there is also a technique known as IVM, which is in vitro maturation of the oocytes. In this case, immature oocytes are taken from the body and matured outside in the laboratory. This avoids ovarian stimulation protocols from having to be performed. However, this treatment is not a commonplace one in all fertility clinics, and it hasn't been shown to increase success rates of the treatment. If OHSS does develop, another option is to take the embryos and cryopreserve them via vitrification for future use, instead of transferring them in this cycle. When the situation has cleared and the patient is now free from the OHSS, the embryo transfer can be programmed without any risks to the patient. In cases where OHSS occurs after ovarian stimulation, it is usually very mild. The patient will have enlarged ovaries and elevated levels of estradiol in the blood. The patient may also possibly experience some mild discomfort, nausea, or abdominal swelling. Although most cases of OHSS are mild, about 4 of them proceed to become moderate cases where there is increased discomfort and abdominal distension or swelling. In a limited number of cases, the OHSS may progress to a much more serious form of the disease in which vascular permeability occurs, and this can lead to problems with blood coagulation and things like thrombosis and blood clots. Additionally, it can lead to fluid accumulating in the lungs. There is also the possibility of ovarian torsion or a rupture of an ovarian cyst. These things, fortunately, are very uncommon, but to avoid ending up in this situation, it is very important to have good monitoring. A good monitoring procedure will pick up any problems early and therefore help us minimize the risks that may affect the patient. Things to pay specific attention to are a sudden increase in your waist size and volume, increased volumes of urination, any pain, especially in the legs, or any breathing problems or difficulty in breathing. If you are displaying mild or moderate symptoms of OHSS, your specialist will monitor you with ultrasound checks to monitor the progress of the syndrome. Usually, a mild form of OHSS can clear up on its own without needing any special treatment. The treatment of mild forms of OHSS is to rest, not get involved in any strenuous sports or physical exercise, to abstain from sexual intercourse, and to drink plenty of liquid. Your specialist may also advise you to take an over-the-counter painkiller to help remove any discomforts that you have. In the most severe cases of OHSS, the patient would have to be hospitalized and monitored carefully, maybe with intravenous fluids and drips, and in some cases have to have the excess fluid drained from their body. Now we're going to have a look at a couple of the most frequently asked questions from our users and answer them for you. I'm under 30. Am I high risk for developing ovarian hyperstimulation syndrome? Well, not really, no. Although being young is a risk factor for ovarian hyperstimulation syndrome, it doesn't mean it's going to happen to you. It is actually a combination of risk factors that's more important. However, should you start to present with syndromes of ovarian hyperstimulation syndrome, your specialist will know how to act quickly to prevent any harm from coming to you. Can I do sports with mild ovarian hyperstimulation syndrome? No. If you are experiencing OHSS, even in a mild form, sports are not recommended. You should be resting. Indeed, any sports or physical activity can be problematic because in this syndrome, the ovaries themselves are actually enlarged and at more risk of being twisted, of undergoing ovarian torsion where they become twisted and placed out of position within the body. It's best to rest in this case. We would like to hear about your experiences, so please do